So this is the point in the hearing where we're going to hear public testimony. And the way we're going to do this is we're going to bring people up in groups of 3. Folks have signed up already. So when you come up to the table, whoever's up first can start their testimony. We're limiting the testimony to 3 minutes because of the large number of people who want to testify. And at this stage of the hearing, all testifiers are created equal, meaning that when your 3 minutes are up, your 3 minutes are up. There is a lot of opportunity to submit written comments, either electronically or the written comment option is available in the back of the room. So anyway, let's get started. And I hope I don't do too much damage to your name. Vic Baker, Karen Myers, Martha Perez. Are you here? Great. And again, whoever gets up can start testifying, and we'll start.
May I go ahead?
Absolutely. And there's a little light there that'll tell you when your time's up.
Okay, thank you. Oops. Can you hear me? Can everyone hear me?
Yeah, and you can actually pull it back a little ways.
Okay, thank you so much for having us tonight. We appreciate your taking your time out of your busy schedules to assist the public in understanding these rate increases and the potential impacts and consequences thereof. My name is Martha Perez. I'm going to read what I wrote. As a former employee for a major nonprofit healthcare insurance company in Oregon, I am proud of my service assisting members to access their medical benefits, answering questions, and suggesting improvements as part of a concerted team effort process. However, my experience also taught me about the challenges that still impact our insurance members, such as cost affordability, cultural and significant language barriers, critical shortage of PCP doctors, and a significant lack of knowledge about available resources on the part of the primarily insured Spanish-speaking Latino families with children that I served during my tenure. I am speaking out today on behalf of the members I serve in order to preserve healthy families in the state of Oregon. I recommend that due to a continued individual economic stagnation in the state of Oregon, that a proposed Blue Cross rate increase be rejected at this time. In addition, if or should Blue Cross decides to forge ahead, it would not only negatively cause current members to drop coverage, but also affect other insurance carriers at this time who may not be in a position to leverage resources equal to or exceeding that of Blue Cross Regents and its affiliates. Number one, the claim reimbursement rate for lower-end insurance carriers is grossly less than what Blue Cross can authorize for their doctors. Furthermore, the concept of partnership that the leader of Blue Cross Regents is grossly limited because of the fact that without higher federal reimbursements, which is a different part of the decision-making process, the state of Oregon would absorb and carry those costs of members who drop out as a consequence of higher rates at this time. I like the idea and would be in concurrent with the recommendations of Laura Etherton of the Osberg organization, and I will submit these comments after my oral testimony, and I thank you for your time. Good luck.
Thanks a lot. Hey, go ahead.
Hi. Thank you for having me here and giving me the opportunity to talk. My name's Karen Myers, and I'm an employee of Regents Blue Cross Blue Shield of Oregon. And I wanted to give you the employee's perspective of our organization and why we're asking for this rate increase. I've actually been at Regents for about 6 years and in the industry for about 20. And I've been watching rate increases year after year for a very long time. And the opening comments, you talked about the cost of care being a big driver and the increase of costs, or increase of premiums, rather. And I was frightened and shocked, just like everyone I'm sure here today, talking about the increase of the 50% plus increases of ER and outpatient surgeries and such that Jared was talking about. It's clearly a not sustainable model, and we realized that as an organization. And having been in the industry for a long time, it wasn't really until I got to Regions that I started seeing a real commitment to doing the hard work of making changes to the healthcare system. And we have committed over the last 6 years considerable resources. A lot of the things that Jared talked about, the medical home research that we're working, or pilot programs that we're working on, creating tools for employees to select the right care at the right time, being able to, the transparency to allow them to see the cost and compare and get the right care that is affordable to them at the time. Jared talked about that we've been around since 1941, but he didn't really talk about our beginnings. And actually, it was a group of loggers up in Tacoma that decided to pool all their resources to help one another pay for catastrophic cases that happened to their families, to protect house and home. And that is what I wanted to talk about today. Is that's a very strong culture that has permeated our organization. Every single employee within every corner of our organization is all about trying to contain costs and make the changes that we can to change the healthcare system and really be a catalyst for change. And it's education, transparency, wellness, and a big part of that is keeping people healthy so they're not in the healthcare system in the first place. We want to have more Kyles and less Kathys and Michaels, and as an organization we are committed to doing that, and my request would be that we approve the 22% increase so that we can continue to do our work to make the real changes in the healthcare system that are necessary.
Thanks.
Thank you.
Go ahead.
Good afternoon. My name is Vic Baker, and my wife and I have been enrollees with Regents program since 1983. Last year's fundamental change to the benefits payout package classified two people as a family, which increased substantially the amount of out-of-pocket expense that husband and wife encounters in the event of any kind of medical issues. That was in addition to the normal premium that was passed along. As people look at this, it just strikes me as it's such a fundamentally economic issue that this is such a flawed system, a flawed business model. It can't continue to pass along double-digit price increases to its consumer base. People know that 12% per year will double every 7 years. So if you think we're going to be looking at a 12% increase on average for 7 years, your monthly premium will double. Now, we're probably greater than that if you look at the statistics that have been placed in front of us to this point. It's a flawed system. It may speak to a single payer. It may speak to other issues. I don't know that that's really the topic today, but it's a point of contention because these types of increases can't continue. I thought Osberg was spot on when they were saying the basic result will be this 59,000 population pool in this particular individual group policy will be forced to choose to self-insure and take that huge risk, drop out of the pool, or drop down in premium in order to increase the risk of the out-of-pocket expense to those individuals. All that serves to do is to create a more unhealthy, smaller population base, which is going to absolutely force the insurer to increase prices as time goes on. So if we're looking at a 22% increase today, and we subtract or we reduce that population base upon which these premiums are calculated, it's going to increase again and again those numbers that this smaller group will see. And speaking as for myself and my wife, that's a risk that we can't take. And so we are forced, because we have no choice, we can't go to another insurer because of pre-existing conditions that will be disqualified. So we're in the mix. Our choice then will be to reduce that premium in order to increase the deductible to make it more affordable, stay where we are and hope that we can continue to afford that, and wait until a more logical business model is introduced on a national level that solves this, as I say, fundamental business model that just can't continue to work. And I appreciate your time. Thanks very much.
Thank you. I appreciate that people want to express their support, but it's more important that we hear everybody. So Dave Young, Carl, whose name I can't read, and Marilyn Heppel Latham. Okay, go ahead.
My name is David Young. I'm pretty much retired registered nurse, 30 years experience, most of those working at level 1 trauma hospitals in Portland area in the operating room. My specialty is vascular surgery. I see so many patients that come in to have their toes amputated because they're black. It turns out these people are diabetic. It also turns out that they don't have any insurance. They can't go to see their general practitioners to get an easily treatable condition taken care of. The emergency room is only the most expensive health care that they can get. So after we take off their toes, then we take off their feet, and then we take off their legs. And eventually they get on Medicare because they're also compromised in the kidneys and they have end-stage renal disease, all because they couldn't get insurance to see their general practitioner, or they don't have a general practitioner to see a general practitioner. The people from Blue Cross Blue Shield, and I understand that they are a not-for-profit organization, but I also observe that they're also the most expensively dressed people in the room. They say they feel our pain. I find this a little disingenuous. But I submit to you that while they say that the medical care system is broken, I suggest to you that the medical financing system is broken. And as Mr. Baker just pointed out to you, what we're seeing is a smaller and smaller pool of hopefully healthier people paying more and more, or paying higher and higher rates in order to sustain the system. And I can't help but have the suspicion that perhaps that's what the reserve pool is all about. They're trying to pump it up as much as they can before they totally collapse. Thank you for the opportunity to have something to say here.
Thank you. Go ahead.
Hi, I'm Marilyn Heppel Latham, and I want to thank you for letting us testify. And I'd also like to say I'm in support of Senate Bill 717, which is going through the Senate right now, which would hopefully have more of these hearings. I looked at the information that was on the website, and a number of things jumped out at me. First of all was the history of rate increases, and I noticed that in the last 4 years, it's been a 98% increase in rates, which means if you would have started with a $300 premium in 2006, by 2010, your premium would be $596. And I'm wondering about the administrative costs that the medical loss ratio for Regents is 80%. That means 20% goes to administrative costs. And if you look at organizations like Medicare, Noridian, which is Blue Cross Blue Shield North Dakota, their administrative costs are 3 to 4%. So I'm wondering why the difference between 3 to 4% for Medicare and 20% for Regents. The need for a 22% increase was given as far as costs in drugs going up, hospital outpatient, hospital inpatient, et cetera. But there was no mention of the increase of 31.6% in their administrative costs between 2009 and 2011. And Jared noted that there are 1,000 fewer employees now in the last 18 months, but I'm wondering why have salaries gone up 29.4%? Just increases in benefits? Where does that come from? In the same time period, physician practices, which is where I've worked, they gave increases of between 0 and 3% in the last few years, yet we see this increase of 29% in salaries and wages for Regents employees. From a professional fee standpoint, they say that the costs have gone up by 6.1%, and having worked very closely with health plans, and by the way, Regents does have total control over what they pay the physicians, and they know exactly what they pay physicians, so I'm a little confused over the shopping around for a cost of an MRI when Regents knows exactly how much they pay each of their physician providers. But physicians have only been offered anywhere from possibly 2 to 3% of an increase from year to year. And so I'm not exactly sure where the 6.1% comes from, especially when I hear anecdotal information about decreases in deliveries of babies, decreases in patient visits, and decreases in cost of elective surgeries. And just returning to the 31% of administrative cost increase, I noted that since November of 2008, the plan has lost 20,000 members, or 25% of their business. So they're losing business, they're losing premium, but they haven't been able to cut their costs. So it appears that this increase is really going to help cover their administrative costs. Thank you.
Thank you.
Thank you for the opportunity. My name's Carl Kiss. I've been a Regents individual member for well over 20 years. I don't even want to think about the tens of thousands of dollars I've paid them over the years, and I've been a profit center for them. I don't know about anybody else. Yet I've never appeared at a hearing before today, and really I'm primarily here because I spent 7 years of my life, as some of you may know, trying to help one group of Oregonians get equity in health insurance. And I felt it was necessary because of that to be here today, even though it's an unrelated issue. I've read as an individual member how Regents maintains this cost increase is necessary to keep excellent coverage available to its individual members at an affordable price. What excellent insurance coverage is my first question. Unlike group health coverage, we have no mental health coverage. We don't have any vision coverage. We used to have it, not anymore. We have no chiropractic coverage, and we have very limited coverage of prescription drugs that are not generic, even if they're the only drug available yet, even if there's no generic available to cover it. Since Mr. Short says in the letter he recently sent you, Administrator Miller, that the increased request in the rates is filed largely due to the rising prescription costs, let's talk a little bit about that prescription coverage. And just one specific example, that's all I have is my example. I've never had a call from a pharmacist before saying, thought I'd better call you and warn you, Mr. Kiss. And this isn't someone whose name I know, but something I've been paying $10 a month for years, a medication that was proven through blood tests that I paid for, that showed that I need a certain medication to keep a very cutting crystal out of my joints to prevent my joints from being destroyed. All of a sudden, $10 was going up to about $300 a month. They had enough coupons to make my cost down to $75 later, but who knows how long those coupons would last. That's just one experience that suggests that this premium increase is not justified. That would justify a reduction in premium, not an increase that experience. The coverages that aren't available to us, that are available to other group health members, would suggest that a reduction or minimum increase would be necessary because those areas aren't covered at all. We have, and forgive me, but I don't trust their numbers. I noticed that they haven't produced the audit report that they had done. Milliman, I think, is the name of the company. It hasn't been produced. There's something in there they don't like, or they would have produced it by now. Add to that the fact that Osberg has found building of a hidden profit into their medical costs, possibly.
I'm going to have to ask you to finish up when you get a chance.
Okay. The desire to build its already significant surplus at a time of economic hardship. These are reasons that suggest that increase is not justified. Folks, we don't have big employers behind us to argue with the legislature what should be covered and should be covered in our policies. That's why we don't get the coverage that we have before. We don't have CUB because this isn't the situation where CUB is there. We have you folks, at least some of whom I know got into this for the right reason to help real people. And you have the power. We're here to ask you for your help. Thank you.
Okay, so the next three folks we're going to call up is Larry Kirsch, Michael Alexander, Brent Savage. And thank you, folks, for keeping to the time as much as you can. You can go ahead.
Okay, well, good afternoon, and I appreciate the opportunity to speak to you. My name is Mike Alexander, and I'm an employee of Regents Blue Cross Blue Shield. Over the last several years, the word transparency has become an often used phrase, particularly in healthcare. And for many people, they believe that it's the end game. But in reality, transparency is where dialogue begins. I've been in Portland for 6 years. I spent 30 years in healthcare, many of them in community-based drug and alcohol treatment programs, before I was fortunate enough to join this organization. And today, while I'd like to talk to you somewhat as an employee, the two hats that I wear are first as the father of a 29-year-old daughter who is an individual policyholder, and secondly, as a citizen of a city that I've come to truly enjoy being a resident of. My daughter confronted me about a week and a half ago and asked me why we were increasing these rates. And she is a well-defined young lady. And we had what I thought was a very rich exchange. And I couldn't give her an answer that was going to meet her needs. But at the end, I had to remind her, remember what it feels like to be able to go in, receive services, and have the level of confidence that you have as a member of Regents. And she would acknowledge that. I also will tell you in public company that I am an unabashed supporter of President Obama. I believe in many of the decisions that he's made and many of the things that he stands for. One of the things that he said that I recall quite often is a statement he made where he reminded all Americans that their neighbors quite often are people who work for health insurers, and they're committed to the overall wellness of their communities, and that we need to remember that in the course of difficult discourse that we have about this business. I'd like to believe I'm one of those people, and I may not be, but I'm positive that I walk into a building every day, and I work with hundreds of them who are committed to this community and to being the kind of organization that people are proud of. I ask as a Regents employee that you consider this increase as justified, but as a father and a citizen, I more importantly ask that we conduct this discourse in a way that at the end of it, once the decision is made, we're able to come together as a community that this city and state has demonstrated to me they can be, and then get to the real business that everybody believes needs to happen in terms of redefining and transforming this healthcare system. These are hard discussions, but if we cannot do them in a way that respects the ability of good people to disagree, we're going to lose in the long run.
Okay, thank you. Mr. Kirsch.
Good afternoon. My name is Larry Kirsch. I'm a health economist and a resident of Portland, and I serve as managing partner of IMR Health Economics, a consulting firm whose practice is national in scope. I've appeared as an expert witness in over 35 health insurance rate cases in states which have formal rate review authority, like public utility rate hearings. And I generally appear on behalf of policyholders and public agencies, people of that sort. I have 3 points I'd like to make if I have the time. I'll start out with the issue of whether the proposed rate increase is justified in light of Regency's financial condition. It's a threshold issue, I think. The division has the authority and the responsibility for determining whether rates are justified and whether they are prejudicial to the interest of policyholders. They were given new authority in 2009 by the legislature to take into account the financial position of the rate filer, and there's been some discussion of that. Let me tell you what I've found when I've reviewed this particular matter. This quarter, Regents applied for an individual premium increase of 22.1%. It comes after applications made by Regents of 14.7% and 19.9% in the year 2009, 26.4 and 25.3 in 2010, and then earlier this year another rate increase of 22.7%. You'll remember, I'm sure, that when Regents was awarded a 25.9% increase in the third quarter of 2008, it was based on the explicit proposition that a large increase then would stabilize rates going forward. That obviously hasn't come about. In the last 5 years, Regents has earned profits in excess of $228 million. In 2010 alone, its profit was $75.2 million. More significantly, Regents earned $146.36 per member in 2010, compared with $30.45 the year before, and going back to 2006, an average of $39.16. Regents is very well capitalized as well. I know that's something that the division is very concerned about, and they have and policyholders are obviously concerned about it too. No one wants to have a company which is skirting with insolvency. Its total surplus per member increased from $787 in 2009 to $1,060 in 2010.
Mr. Kirsch, I'm going to have to ask you to speed it up. We've got just a couple more minutes.
Okay. The measure the division conventionally uses to judge capitalization is ratio to risk-based capital. Laura Etherton spoke about that. It grew 34% from 2009 to 2010, and many companies are operating with risk-based. Many well-managed companies are operating with risk-based capital well below what Regents is operating with today. Indeed, it seemed to me that the number for Regents' risk-based capital, even so, was understated because of the $56 million that they distributed upstream to their holding company. And if that had been applied, say, to rate relief for this line of business, rate relief here, the amount that they're asking for is $29 million. It would have provided 2 years of 100% rate relief for subscribers here. Given the company's extraordinary profitability and capital and surplus situation, I question whether Regents can justify the need for any increase at this time, and I respectfully would ask that the division pay particular attention to the new authority and the new standards that the legislature has given to judge Regents in light of its financial position.
Thank you.
Thank you.
Okay. Next, Ann Fisher, Paul Gorman, and Tori, who's...
We have another person?
We still have.
Oh, I'm sorry.
Oh, it's
And your last name is Savage, too.
I just thought you'd renamed me Ann.
That's right.
My name is Brent Savage. I am a Regents employee and a Regents member. I also have a grown child who is a Regents individual member. Never before have I seen the topic of healthcare engaged in with so large a percentage of the population with such fervor and such passion, and I think that's great. It's also overdue. The first time I ever heard the phrase, the healthcare system is broken, was from the CEO of our company, and I agree. What I can tell you with respect to this rate increase is I trust that advocacy groups, Regents representatives, the regulatory bodies will do the right thing, and it will vet whatever the decision should be with respect to this. What I can tell you also is that, to echo Michael's statement, is that I have also never worked for a company where getting something done, the linchpin for that was do the right thing by the member. I used to work for a for-profit company, and now I don't serve shareholders, I serve our members. I am fortunate enough to work in the customer service department, and consumers not only have so much more decision-making responsibility and pressure as to whether or not they're able to afford coverage, but even within that, can I afford this service? No longer are there $10 MRIs. There really never were. Somebody else paid for those too. But now there's more co-insurance, more skin in the game, and so each healthcare decision comes with a greater financial implication on a transaction-by-transaction basis. What I can tell you is that internally, stewardship of members' premium dollars is a watchword that guides all that we do. Making our processes lean, increasing auto adjudication, and in fact reducing staff are the drivers that will reduce administrative cost internally and lead to more efficiency with which we can serve our members.
Thank you. Thank you, panel. And my apologies, Mr. Savage. Okay, now Ann Fisher, Paul Gorman, and Tori, whose last name ends with S-K-I. And you can go ahead and start.
All right, thanks. I'll go ahead then. Thank you for the opportunity to speak here today. My name's Paul Gorman. I've been an Oregon doctor since 1984. If my voice is shaky today, it's because I feel so passionately about this problem. I started out as a rural primary care doctor, and now I teach at the medical school. Along the way, I've found everywhere I worked terrific nurses, cutting-edge hospitals, and the best doctors, all trying to do their best for patients, but held back by an insurance industry that keeps making it harder and harder to do our jobs while putting profits ahead of patients. Now, I know they told us they're not for profit, and we all know that just because you're not for profit doesn't mean you're against it. In 2009, in the midst of a deep recession, health insurance companies increased their profits by 56%. And just this month we heard that this profitable industry not only was more profitable again, but 30% higher than had been anticipated. What do people want from their healthcare system, and what is Regents and the industry delivering? People want access to healthcare. And what they're getting is the opposite. Copays, deductibles, high deductible plans, premiums that price them out of the market altogether. Americans get less basic health care than people in any modern nation. What people want is to choose their own doctor and hospital. What Regents and others deliver is restrictions. You have to drive across town past one hospital to get the one that they approve. What people want is patient-centered care. They want to decide with their nurse practitioner or their doctor what's best for their situation. What they get is company-approved care. Doctors and hospitals waste millions of dollars on paperwork, pre-authorization, trying to do what's best for the bottom line, not for patients. What people want is affordable care. What Regents and the industry deliver is out-of-pocket costs that are higher than any modern nation. Each of us is one serious illness away from bankruptcy. A 22% rate hike for individuals will only make things worse for those who can least afford it. Young people, small businesses, the self-employed. We'll see more medically homeless, not medical homes. And we'll see those people in the ER and the hospital far sicker than they needed to be. Regents is promising that they'll fix the system. And we've heard them here today blame everyone else for the problems. But their solution is to displace the risk and the cost to somebody else while they continue to be profitable. And they've been singing this tune for decades. In 27 years as an Oregon physician, I've seen them make it harder and harder to do what's best for patients, while their profits soar and health outcomes fall. It's time to say no to the big insurance industry. It's time to say no to Regents on this increase. Thank you.
I know folks want to clap, but I really would appreciate it if you didn't. The best way to show your support is to either fill out a card in the back or email us to discuss the testimony that we've already heard. So go ahead.
So my name is Tori Jedrzykowski, and I am a Regents employee. I chose Regents when I came to work for Regents 3 years ago was a lot of the fact that I knew the Blue Cross Blue Shield logo from childhood. I always had a blue card in my wallet, my parents. I'd say that, coupled with their commitment to the community and their involvement with the community, was a big reason why I chose to go and work for Regents. I'm a unique Regents employee because I'm not a member of Regents. I'm a member of another local health insurance company. My husband's a teacher, so we are with his coverage. And last year in October, we faced a 29% increase with our plan. And they cut benefits as well. And I think out of all 5 plans that were offered to the school district, every single one of them were upwards of high 20% increase on those plans. In addition to facing that, my husband's sick. And we've been dealing with 10 years of going through things. And I can speak to this past year, and I'm speaking to cost, is that over 3 surgeries in 9 months, it was $250,000 that came through on our bills. Our out-of-pocket was premium, and our out-of-pocket maximum was probably $15,000. But the insurance company paid $250,000 in 9 months on his behalf, 1 year. That's not including the 9 years prior that he was going in to have Remicade injections that were 3 hours long, and the bills came between $6,000 and $8,000 every single time he went in. I find that it's my duty working for Regents to help others and educate and help them strategize and find a way to make it work. I have found myself actually helping the school district who Regents doesn't insure, trying to help these people that don't understand insurance make good decisions and understand based on their personal situation what would be good for them. I feel it's our duty. It's everybody at Regents' duty, whether they're our member or not, to help and spread the word about what the cost of care is. I feel that just in my short time and being able to do that with the people I know, whether it's family, friends, or neighbors, that they've been able to spread the word as well. So I come from a different view of it. I'm not a Regents member. I'm an employee, and we do the right thing every day, and we work very hard for our groups and our members every single day. Thank you.
Thanks. Okay, the next group is, I think it's Steve Padden, Catherine Penna, and Scott Stafford.
I was close. It's Star Padden.
Oh, okay. My bad eyesight and your good writing. So, go ahead.
Yes, I am a former Regents employee. I'm now one of those dreaded baby boomers. But I worked for the company for 34 years. I worked for physicians for 6 to 8 years before that. And I've listened to all the comments, and reality is always somewhere in the middle. And I'd like to expand a little bit on what Mike Alexander said, talking about the dialogue. The reason that I agreed to come down is because now that I'm just a citizen of Oregon and not working, I believe that this is a tip of the iceberg type of situation that allows people to, express the condition that we're in, which is almost like a perfect storm. And it's not a typical situation. There's no jobs, there's no way to pay premiums, there's no way to buy houses. There's a lot of things going on that are in the mix on this. And so I'd like to say that some of the issue that we're talking about is a little further upstream from insurance rates, which is the cost of medical care. And I'm sure the doctor that spoke could talk about that. Medical care cost and the delivery system, not just healthcare system, but the healthcare delivery system is what is broken. And we as regents, when I was working there, I couldn't turn around and tell a drug company, you can't charge, $150 for this pill for this person. We don't have that leverage. But the public does. And if a dialogue like this can be the beginning of a dialogue that brings in everybody at the table, not just the insurance companies, but you need to bring in the drug companies, you need to bring in the suppliers, you need to bring in medical research. There's a lot of people who are part of this whole dialogue. And I think if you use this as a springboard for that kind of a discussion, then it'll be a much bigger discussion than just rates. That's my...
My name is Catherine Penna, and I am a Regents employee. And I wasn't planning on speaking tonight. I was just planning on being here to listen. But
people have been great about being courteous to the witnesses, and we appreciate your continuing to do that. Lots of opportunities to make comments, including online and testifying yourself. So go ahead.
Okay.
Well, that's fine.
Of course the Regents employees are going to support this increase. Of course, it's in their self-interest. It's not in the interest of the public.
And anyone who wants to testify, because this is a public hearing, anyone who wants to testify is free to do so.
I'm going to say I don't feel qualified to say whether or not this increase should be approved. That's not what I do for the company. I will say that every single day I see rising healthcare costs. Yesterday, I, with Regents Insurance, went to the pharmacy and paid $60 for 4 pills of an antibiotic. I paid that out of my own pocket, and that was my cost after my insurance picked up. The system is broken. It's been broken for a long time. Regents is not the first Blue Cross and Blue Shield that I've worked for. I worked for another nonprofit across the country, Blue Cross and Blue Shield. And we don't tell doctors how to bill. We don't tell hospitals how to bill. And we don't tell them how much they can charge. But we pay those claims when they come in every day. And one of the things that I see when I look at the claims and when I look at the way things work is that if a doctor is associated with a large clinic that is associated with that is owned by a hospital, they can bill twice. They can bill a professional fee and a facility fee, and we pay twice. And the money has to come from somewhere. We have to be able to pay for it somehow.
Thank you.
Thank you.
Thank you.